Steve.
So I wasn't able to be at the session this morning, but in just attending this afternoon, couple of takeaways wanted to share, kind of similar with the other panelists here so far. So one misconception I wanted to dispel is, even though we're Institute of Transportation Engineers, we're not just engineers. A lot of our members are planning professionals, public safety, a lot of folks involved in the transportation process besides just engineering. With that said, a lot of our members are transportation engineers, particularly at the local public agency level. And I think the question of transportation health is not necessarily a new one for a lot of our members, but I think the challenge is being able to personalize it. And I think that's one thing that is a strong takeaway for me in just listening to the presentations today. I'm sure many of you have heard that transportation is what's referred to as a derived demand. There's not the value is not in and of itself, but rather through the activities that you're able to facilitate as part of being able to complete a trip, get from point A to point B. And so I think one focus for ITE that we are trying to underscore with our membership is not only not improving transportation for transportation's sake, but rather tying it to this idea of more livable communities, making that work and play aspect a larger part of any transportation user's environment. And so that's, I think, one thing that I think was underscored for me today. I know it's been mentioned a number of times, the use of data and measurability and performance measures, especially when you're talking to like a group of engineers. I mean, they thrive in that data-rich, objective, hard facts environment. And so the more that we as a broader community and transportation profession and stakeholder group can collect that data and tie it to particular performance measures and health and transportation measurable outcomes, I think we'll continue to see a greater level of adoption and buy-in from stakeholders within the transportation profession. The last thing I'll just mention, I was comforted to hear just this afternoon some mentions around safety, and just understanding how closely linked transportation health and transportation safety are. And I think that's a space that's a lot more familiar for a lot of our members and a lot of transportation professionals, is that idea of reducing fatalities, reducing crashes, and making that environment more conducive to moving from point A to point B in a safe manner. And I think one thing that I try to communicate with our membership is, a lot of times when you make a roadway or you make an environment safer, you also make it healthier. And so I was happy to hear that underscoring that connection in the sessions this afternoon. So with that.
Thank you, Steve.